Hello everyone, welcome back to a new session here with pre-health shadowing. Thank you so much for joining us. A big welcome back for our continuous students and a big welcome to our new members if this is your first session here with us today. A little bit about us, what we do, and who we are. Pre-Health Shadowing is an international student-led, women-led, minority-led, and it's a nonprofit organization that works on medical advancements along all students, either in college or even with high school students. We do like to accommodate everybody's needs and abilities throughout the session. So we do have closed captions for you guys if that's something that will help you and meet your needs for anything. If you have more ideas on how we can have our sessions more accessible and more enhanced for you guys, please you can have an email us at info@prehealthshadowing.com and we'll be very happy to accommodate anything that would work with best with your abilities to have the best live sessions as what you expect it to be. To stay also more into the loop with PHS, you can always join our mailing list, which is a very easy, quick 2 or 3 questions form that you can find it on the website. You can put it in the chat as well that you can join to stay in the loop for any upcoming events and live sessions. Other than the emailing list, you can always connect with us through Instagram, TikTok, LinkedIn, all of these social media platforms, and you can find us with the handles at Pre-Health Shadowing. That's where we have a lot of updates on there, like new sessions, new events with all the organizations. Pre-health shadowing is not just about the live sessions. We do have other departments as well. So you will find a lot of updates on there, any other events or any other opportunities that you guys can join us other than just joining the live sessions. One thing very great about PHS is that we have students from all around the world. Sometimes we see people like overseas at night logging in. So please go ahead in the chat, let us know from where you're joining us here today. If you would like to stay more into the loop of PHS other than just joining as a student, which is for sure still a very great thing to do with us, and we're very happy to have you guys. You can always join us as a student volunteer or a team member, or all of the roles are voluntarily done, but we do have different expectations on each one. The student volunteer is more like a volunteer that you can choose the department within PHS, not just the live sessions, but any other one that you're very interested into playing a role with, where you can just join and help out with other roles that people are enrolled of. While a team member, where you'll be fitted into a role that you're very responsible of fulfilling. Both of them require different kind of hours or more commitments. You can choose whatever you want that fit with you, with your schedule, your responsibilities, and you feel like a best fit for. And whatever you choose to join with us and stay with us, we're very happy to have you. Again, about the roles of being with PHS, there's nothing to worry about being in person or traveling about anything. It's fully remote behind your computer. You choose where and how and when to join and do the whatever responsibilities that's required of you. So it's very flexible and the team is very welcoming and everything on it. It's just enjoyable to be with. PHS, again, it's not just about the live sessions that we host with our very perfect, great professionals, but we do have different departments. We do have like a research department where we work on like research projects, where we match students with mentors, where you can get to learn more about research, how to get involved, do research, and all about that. We do also have other departments like systematics, like the IT, the grants. We do also have finance. We do have multiple, like a volunteer and communication department. So you can get to choose whatever role or department that you would like to play a responsibility within, either as a volunteer or taking a role within the department. And all of that you can easily do on the website. We will have a form. We will post it in the chat in a bit where you can fill it out. It's very easy, just a little bit, few questions about yourself, where you're at in your journey, why would you like to join, then which department or place would you feel like you're best fit for. PHS is not just about college students or people that are declaring that they want to go into health, but it's also for high school students that are just stepping into that journey. So we do have an HTP program, which is offering a program for high school students that offer leadership and healthcare educations for them to know how to step into the journey, what it takes to go into it, or step before college as you go. So when you start college, you're a little bit ahead of a start and compared to any other ones with in regards of how does the education go. We do have a lot of chapters within a couple of USA high schools that if you have one in your school, please stay within the connection with so you can gain all of the resources and dedication necessary that thing you need. Again, it's a very easy form. We will have it in the chat. So if you're in high school, you can fill out the form. It's a PHS, it's a nonprofit organization. And so we do rely a lot on donations to keep this program for you guys for free and accessible as possible. So if you can scan the QR code, donate even if $1 and make a difference, or if you can share it with anybody that you know that can donate, please do so. Throughout this session, I'm sure we're going to be learning a lot, so much from our great professional here today. You can always feel free to type any questions or thought in the chat that you have during, and we will have a Q&A section at the end where you can unmute or just type in the chat any questions that you want to ask and to get your answers. I'm sure we're gonna have a lot of good takeaways. If you feel like you need something that you want to write it down or research to save, you can please go ahead and do so. It's something I can always refer back to. And within the shadowing, you will be able to gain a certificate at the end when you take a quiz. The quiz will be on the website and it will be ready for you guys right after this session. So if you want to take a notes to keep that for the quiz or just for anything for you, please free to do so. Since we're all remote, so a very good thing to keep us all engaged. If you guys can have your cameras on, that's one way that we can keep the sessions more personally, not like personally, but like engagedly as much as possible. So if you guys can do that, that would be great. And that's all on my end. I'm gonna go ahead and give the floor to our professional here. She have a lot of very great information to share with us on being in gastro and what it takes to be over there.
Great. Thank you, Heba, and thank you to all of you for joining today. I realize that as I saw your information coming across the chat, that you're joining from all over the United States, along with all over the world, and that's really exciting for me. I commend you all for creating this forum and opportunity to share information with one another and to learn. And I'm really happy to be able to share my journey with you today. Let me see. I don't think my slides are being shared. Hold on just a moment. Make sure this is being shared. Can you see my slides okay?
I can see them.
Okay, perfect. Okay. Um, there are so many individuals who have influenced me and shaped my thinking throughout my journey. I've been with my current position and medical group for over 25 years. And, I think I'm very hopeful that I'm going to share something with you today that will spark your curiosity or really just inspire you to think about doing something new. Throughout my leadership journey, I have realized that leadership is really about opening doors, breaking down barriers for others, and creating opportunity. And this is very similar to what I have experienced from countless individuals throughout my career. So I firmly believe that doing this is absolutely key for my leadership. So I thought I'd share this with you. This was, a time in my life that was actually very, very difficult for me. I actually had been at my role for a period of in Fresno, California, for a period of 2 years or 3 years. when I went from a department of 3 individuals down to a department of 1, myself with a brand new newborn in hand. And this was some recognition that I received after that episode. But I thought I'd take a few steps backwards and just talk to you a little bit about my journey. So as you probably saw in my bio, I had the honor of attending Stanford University. That was a dream for me. I had applied to a 6-year undergraduate combined medical program on the East Coast and was not accepted there. And I had applied to UC Berkeley. At that time, you didn't apply to as many schools as people do at this time to get into college. And I had received early admission to Berkeley in November. So when my Stanford application became due, I took a bit of a risk on my application, knowing that I had to differentiate myself in the eyes of the reviewers, especially because I was going to a school where so many of my classmates were the children of Stanford professors. So the dean at that time, Dean Fred, he asked for a single word and adjective to describe ourselves. And I described myself as colorful. This was a compilation of all of my experiences from elementary school through high school, my multicultural background. And I took each word that fed up to colorful and penned it in a different color. I spent all night doing this. And I was accepted. And it is likely one of the most impactful points in my life because Stanford opened a lot of doors for me. First off, just socially, I joined a sorority and I became a little sister, and I made friends people that I stay in touch with now after 40 years. I also did research. I taught vertebrate anatomy. I tutored elementary school students in East Palo Alto, and so on and so forth. And the education that I received there was just phenomenal. And as I applied for medical school, I was able to stay at Stanford Medical School, and there I met my husband. And I had at Stanford Medical School probably one of the most impactful mentors that I've had. His name was Kenneth Melman, and he was a professor and prior chair of the Department of Medicine. And I happened to have him chance encounter as an attending on one of the wards that I was serving on as a student, having stayed up all night, seeing patients and writing up, and then having to present the next morning. Dr. Melman, for one reason or the other, really took me under his wing, and he shepherded me through a lot of my decision-making process through the next couple years. And then I went to UT Southwestern, Parkland. As many of you know, in order to match for residency, you go through a process of interviewing, and then you list your choices. And I think after 8 years at Stanford, I was ready to leave. So I listed Stanford as number 3, University of Washington as number 1, and then UT Southwestern as number 2. Now, why Dallas? You know, it was this amazing county hospital. It was huge. They had 3 emergency rooms for adults, OBGYN, medicine, surgery, and then 1 pediatrics. It was just a level 1 trauma center. And it was so impressive when we went in terms of the way that they taught. And so we ended up in Dallas. And in Dallas, my very first attending was Dr. Gene Wilson. He was the editor-in-chief of Harrison's Book of Medicine. And he did pass away recently, I think at the age of 88. But from there, I fell in love with GI and met another mentor who handed me off to UCSF. And at UCSF, I was able to work with incredible physicians, including liver transplant surgeons. And I had an affinity for the liver. It's just such a complex organ. And I did research there and worked with two amazing surgeons, Dr. Nancy Asher and Dr. John Roberts. And it gave me a taste for academic medicine. Academic medicine is this compilation of patient care, teaching, research, and it's very exciting and very fast paced. And when Stanford launched their merger with UCSF, it sort of just launched me into teaching because there was a lot of change in the Department of Gastroenterology at that time. And so I went into a junior attending role as I finished out my fellowship at UCSF. And as I mentioned, from UCSF, I went to Fresno. Why Fresno? Well, my husband is a pediatric cardiologist and he was recruited to a site in Fresno. And so we went to Fresno with our first child in hand. And I joined the UCSF Fresno campus and taught there and took care of patients and did a bit of research, but not as much as I had been doing. And as I mentioned, after a couple of years, I was alone in a department of one with a newborn, and it was one of the most trying times. And I think as I look back on that, it was character building, it was developmental. It, makes me realize that being a physician is a calling. It's not a job. It's a life identity. And it's a commitment to serve others as your first priority, even when you're facing personal hardship or tough times. And that became my North Star as I navigated through my career. So, as chief of my department, which I became as a department of one, I had to build the department. I had to contract with outside providers and hire internally. And I really had to figure out how to balance my life, balancing the on-call demands of caring for patients and having a young family. And I learned along the way that opportunities will come. And it's really sort of making sure that you prioritize what opportunities you want to seize and whether or not you're going to say yes this time or wait for the next one. And for me, it was always this balance between being local for my family, and then at the same time, being able to pursue my professional dreams. And so my leadership journey did begin with the chief role, which then after a few years led me to be tapped to be the chair of gastroenterology across Northern California. And I served in that capacity for nearly a decade. That was my community at the time when I was alone in Fresno as a gastroenterologist and building a department, a very young department. It was nice to have people from UCSF and Stanford and other places that I knew from my training that then were in the core Bay Area that I could then kind of talk about cases with and have as my community. And after that, I was asked to work as an assistant chief of staff or physician in chief to help with access to care and health promotion. So one of the fun things that I was able to do in my role in health promotion was really to organize a service event at a church in downtown Fresno. And in addition to teaching about healthy eating and leading diabetic seminars, we had a health fair and we had blood pressure checks and other things. And it was really well attended. And this was a really important learning for me because being a physician is more than just being on call and, trying to run things in your department and make sure that care delivery is going well. It's really about addressing health in your community and meeting patients where they are comfortable often leads to better outcomes. And so this was a key learning for me, and I thought I'd share it with you. I think this idea that being a physician, no matter whether or not you have a formal leadership title, means that you are a leader really resonates because in a role like this, you realize that you have this opportunity to engage your community in total health and really to promote lasting change for individuals. So after 16 years of leadership in various roles, the past CEO at that time asked me to lead the Fresno facility as what's called the physician in chief or chief of staff. That job is really about delivering care across a facility, a hospital, working with community partners to deliver care for the people that are seeking care in your facility. And again, having an impact on the community. So this was a service event that I thought I'd share with you. It happened to be on Martin Luther King Day. Martin Luther King, such an inspiration. And we went out and we were building these tiny homes and creating a garden at the Poverello House in Fresno, which is a homeless shelter. And it was a really exciting time to be able to do this. And in addition to that, I had the privilege of overseeing so many leaders in the medical center, chiefs, physicians, nurses, and staff. And I could impact care delivery there. And there's a lot of interesting things that we developed together. We created a memory clinic for the elderly and urgent care that was run by an interdisciplinary team supervised by emergency room physicians, a senior surgical care program, which now is being rolled out across our national Kaiser Permanente program. So after about 4 years in this role, I was selected by the new CEO to join his team at the headquarters. And that is the current role that I serve in now. It's part of the inner cabinet of the CEO, what's termed an associate executive director. And I have the privilege of overseeing and influencing healthcare at a local level at the medical centers. And we have, as you know, over 19 plus hospitals, a regional level, meaning Northern California, and nationally for the Kaiser Permanente organization. In my role, I oversee over 30 directors and chairs of surgical and procedural service lines. And what I love about that is I can guide and mentor people just like people had turned and guided and mentored me over the years. It's really been a full circle experience. And it's this idea of taking their ideas, what I call systematizing grassroots ideas, and transforming care delivery. And it's such a joy to be able to practice this way. And who would have thought that work could be so much fun? So I want to switch gears now and talk about the current landscape that we're facing. We've been in a perfect storm after the pandemic, and our patients happen to be more ill than they ever have before. And if you look across the nation, healthcare quality has been in decline. Unfortunately, the United States spends twice as much as other developed Western nations with not the same type of outcomes. And the pandemic really unmasked this insatiable need for mental health or behavioral health services, and also caused a lot of people to defer care, preventative health care. So they're screening for colorectal cancer, mammography for breast cancer, cholesterol, etc. And because of all of this deferred care, along with a lot of other reasons with respect to financial and economic pressures on healthcare, we've seen that people are deferring their care and they're not seeking care the way that they used to before. And we see that people have more short tempers. You read about it in the news, and we had that recent horrific event. We've understand that everyone is vulnerable right now, including our physicians, our patients, and people that try to make healthcare delivery better. We are seeing, as you know, there's been a lot in the United States with respect to legislation and maternal care. And we're seeing increased maternal mortality as a result of that. And as I mentioned, there's a lot of financial pressures, increased costs for supplies, labor, workforce, and then, of course, this illness burden. So it's like this perfect storm. It's the best way to describe what's happening in medicine right now. And when we're faced with the perfect storm, it's a time that tries you. And it's a time where you need to, again, embrace your North Star and think about your purpose and why you're here and what you want to do. And again, medicine is a calling. We're here to take care of other people. It's a privilege to become a physician and to be so intimate with your patients in terms of the problems that they face and trying to find solutions that are tailored for their needs. So holding on to that as we face all of these obstacles is really, really important. And if you were to take one thing away, I would ask that you sit down and figure out what your personal mission is, what's your purpose, and what's going to guide you as you go through difficult times in your life. So we're seeing, because of the pandemic, a lot of change from disruption. And that's happened. As you know, there was a lot of innovation during the pandemic. Being on a virtual call with people from all over the nation and the world is one of the changes, right? That we very much became accustomed to taking care of people and discussing things virtually. And we're seeing shifts in what happened in 2020 and 2021 to now. So there's United Health Group eliminating virtual care service, Amazon moving away from One Medical and pharmacy in some areas, Walgreens, Walmart shuttering retail clinics and virtual services because they've had tremendous losses, but really because patients are sending us a message. Patients want to be seen, and they want to be seen by a trusted provider because trust matters. And I think, as I think about what's happening right now and where we are, what strikes me is that if we put the patient in the center of everything that we do, the patient, the family, the community, and we deliver on that, we can't go wrong. And that is how I like to think about things as I try to influence and help people to shape healthcare delivery. It's very complicated, healthcare is, and it's also very personal. And if you want to do it well on both levels, it requires an ability to be nimble and flexible at all times. So I want to introduce you to Kaiser Permanente. Kaiser Permanente is a health maintenance organization. That means we are a pre-paid healthcare institution. People pay dues and then they get their care with us. It's not volume-based, it's not fee for service. And so there are different drivers in terms of how we deliver care. We are integrated, which means we have many different disciplines working together within a medical group. We have interdisciplinary teams, and then we have teams across with healthcare administrators. And this is really very important in terms of understanding how we deliver care, because we deliver care in a way that is considered value-based. So value really means creating quality at the lowest possible cost. And so when I think about quality, it's how are we operating? How are we running things? What's the healthcare delivery system? How do our patients experience us? Do we give them an exceptional care experience? And for our people that are working, are we giving them that joy where they feel like they are making a difference in the lives of others? And can we do that at the most affordable point as possible? And the more in Kaiser Permanente, that we can leverage our strengths, integration, teamwork, and create this one Northern California approach, the better poised we are to succeed. And so that is my job as a member of my current CEO's team. This is my job, and I really enjoy it. So I'm going to pause there. I know you said we would have time for questions at the end. We could do some questions on this part, and then I have 4 cases for you that I wanted to take you through just to stimulate how you think about medical problems. So, Heba, why don't you advise me? Do you want me to pause here or wait till the end for questions?
Um, I would say up to you, but maybe if you go through the cases, maybe people
Okay,
will have more ideas of like what your work job is, what cases you get, that maybe promote more
okay,
questions for them.
great.
Mhm.
Okay, so I just realized I maybe have not been advancing slides, so I apologize for that. Um, so wanted to go through 4 cases with you and have you kind of think about how we deliver care in gastroenterology. So gastroenterology is really a huge breadth of care delivery. You go from the mouth all the way to the anus. Included in there is the liver, and there's nutritional issues, and there are disease processes that can affect your body from your hair to your skin, so it's a pretty expansive field. And so what I thought I'd do is I'd just give you kind of a smattering of cases and touch on some of the more common diseases. And then I'd like for this to be interactive if we could. So let's start with the first case. So this is travel medicine. This is fun, right? So a young person comes in, they've got fever, headache, diarrhea. They've been traveling to Southeast Asia. They presented 7 days prior and were treated empirically with an antibiotic for suspected bacterial diarrhea, and they got worse. They report that while they were in Southeast Asia, they were swimming, hiking in rainforests, and embarking upon some adventurous eating with street vendors and things like that. The person has no tick bites, but they see some scabs on their shins and their ankles. So any idea about how to approach this? When you're taking a history, you always want to look for clues. So the clues here was that they're traveling. So there are certain diseases that may be more common in certain parts of the world. The other is, what symptoms are they having? They have fever, headache, diarrhea. Had they sought care before? Yes, this person came in to the emergency room and they were treated as though they had a traveler's diarrhea, but they got worse. So obviously the antibiotic that was decided upon was not the correct antibiotic, or that was not the correct problem that they had. And then there's these other clues, right? So they were swimming in fresh water, they were hiking in rainforests, and they were having adventurous eating. And then they have some breakdown on their skin, right? So you start to think, okay, what's in this? And you formulate what we call a differential diagnosis. So you go from taking a history, doing an examination, and then getting some blood tests and other laboratories and perhaps some imaging, depending on the situation. And then you start to put together, what do you think this is, right? And so any idea here what tests you would recommend? Does this sound like TB? Is the person coughing with high spiking fevers? And, can you get diarrhea from TB? Certainly you can get diarrhea from TB, but typically it's chronic. When it sets up in the small intestine, you can get diarrhea from TB. Leptospirosis. Does anyone know what leptospirosis is? Leptospirosis is a bacteria that you can get from direct contact with the urine from animals. And it gives you nausea, vomiting, diarrhea, chills, red eyes, a rash, a headache, etc. Does this person need an endoscopy with a small intestinal biopsy? That's done to look for tropical sprue. A little bit of a short time frame again for tropical sprue here at 2 weeks. And then do they need to be checked for something called Campylobacter? Well, you've already treated them for a bacterial diarrhea. Probably unlikely that they have Campylobacter. So any ideas of what this might be? Look at the clues. What was he doing? Freshwater swimming, hiking in rainforests. Any ideas?
A
Okay.
lot of them are saying B in the chat.
Oh, are there some things in the chat? I'm sorry, I'm not monitoring the chat.
Yeah, some people just putting their answers in the
Oh,
chat.
B. Okay, perfect. Who said B? And why did you say B?
And it said, I think you should do B to test for antibodies from possible LB infection.
Fantastic. That is the correct answer. So as mentioned, leptospirosis, it can happen in Asia, it can happen here, it can happen anywhere. You go into fresh water and you're swimming and a animal that's infected has urinated in that water. So you can get it from a dog, you can get it from a cat if they're ill. And it causes a lot of fever and aches and chills and kind of injection of the eyes, or redness of the eyes, a rash, headache, etc. And the treatment for that is an antibiotic called doxycycline. And this person did go on doxycycline and they got better after a period of time. So let's go to the next case. So this is a 43-year-old with progressive weight loss and anemia requiring repeated blood transfusions. They deny any change.
I don't think your slide have changed.
Oh, I'm sorry.
No worries, they're good.
Okay. Here we go.
Thank you.
This is a 43-year-old who presents with progressive weight loss and anemia requiring repeated blood transfusions, denies any change in their bowel habits. Their medications include oral contraceptives, iron, and vitamin C. When we look at the laboratory tests, they have an anemia, their hemoglobin is low. It's iron deficient because the ferritin is low, and ferritin is the best marker of iron deficiency. They have a normal vitamin level of B12 and folate. Those are both B vitamins. Their iron level itself is low. And then they have an elevation of a very specific type of antibody, what's called the tissue transglutaminase antibody. And the IgA is elevated. They have a colonoscopy. It just shows a small tubular adenoma, which is a benign finding. That's what's considered a polyp. And then they have an upper endoscopy, and they have blunt and flat villi. Those are the little fronds in the small intestine that allow you to absorb things like iron. So what are the best next steps? So a woman, weight loss and anemia. She's has, as you can see, iron deficiency, and she has this very specific antibody that's elevated. What do we think? Is it in the chat?
Yeah, they're saying D.
Yes, you guys are smart. Yes, gluten-free diet. There's a lot of things that can look like this. So in addition to celiac sprue, if they had a travel history, it could be a tropical sprue. If they had low serum IG levels across all M, A, G, all their IgGs or all their immunoglobulins were low, you would start to think about common variable immunodeficiency syndrome. So there's a lot of things that can cause the blunt and flat villi, but they're clues. And again, you have to know the clues to be able to discern the diagnosis. So let's go to the next case. So this is a patient with ulcerative colitis. Ulcerative colitis is an autoimmune condition of the bowel. It's in the same spectrum as Crohn's disease. And they come in to the emergency room with crampy lower abdominal pain, diarrhea, rectal bleeding. They have fever, but no abdominal distension on physical exam. The blood tests show a high white blood cell count, mild anemia, and then elevated inflammatory markers. These are blood markers that look for inflammation in the body, but they don't tell you where it's coming from. This is a C-reactive protein, the erythrocyte sedimentation rate, and stool tests are done, but there's no infection. A sigmoidoscopy is done, and there's these ulcers. They're like punched out ulcers and inflammation of the colon. And the biopsies reveal what are called owl eye lesions on the histopathology. So what are the clues? The patient has ulcerative colitis. They've been on treatment for some time. They have an elevated white blood cell count with some anemia, and they have inflammation in their body. And the flexible sigmoidoscopy findings are very telling in terms of these ulcers with the inflammation in the colon. And then most revealing are the intranuclear inclusions or owl eye lesions. So what's in the chat? What do you think it is?
So we're all predicting that it's A.
You are all correct. Oh my God, you guys don't even need to go to medical school. That's great. Yes, you're correct. And, C. difficile would have more of these like volcanic like eruptions with pus pockets in the colon. And tuberculosis, as I mentioned earlier, tends to involve what's called the ileocecal area, which is the small intestine and the cecum. And then salmonella would just show inflammation in the colon and wouldn't have any discrete finding, but you would have some findings on the stool tests along with on your biopsies. Okay, let's go to the next. So this is the last case, actually, and then I think we can open it up for some Q&A after this. This is a 38-year-old who comes in with 4 weeks of vomiting and weight loss, 7 months after a gastric bypass. He's dehydrated, he's confused, he's given some fluids, and he's given dextrose. And by the time he reaches his room, he's even more confused, and he has ataxia, which means he's kind of walking, unsteadily, and his eye muscles are going back and forth with nystagmus. He's not a drinker, and they run a toxicology screen, and there's nothing there in terms of any sort of toxic agents or illicit drugs. They do an MRI of his head and an endoscopy to check the anatomy after the bypass, and everything looks fine. So what is the likely source of his deterioration? So there are some clues here. They had the gastric bypass. They were given D5. And they've had a lot of vomiting for months at a time. This predisposes you to vitamin deficiencies. Which one is it? What do we have in the chat?
Most of them saying A, some of them said B. C.
Correct.
Sorry, C.
Yeah, A is correct. Thiamine deficiency. And now the bonus is, what is the name of this condition? Any takers? Is there anything in the chat?
They're saying wrinkles.
Wernicke's encephalopathy?
Yep.
Yep,
Or
that is correct. And this is why people who have alcohol substance use disorder, when they come into the emergency room and they're ill, they're not just given dextrose. They're always given what's called a banana bag, which is dextrose with vitamins in it. The thiamine makes the dextrose saline look yellow, and that's why it's called a banana bag. So I just thought I would give you a few cases so you could get a sense of what GI is all about. It's such a fascinating field because you couple all of this need for intellectual thinking along with the need to do procedures, along with the liver disease, and then this ability to bring it in with all kinds of other conditions. And it's really an exciting area when you think about it, from the liver, the pancreas, the intestinal system, the skin, etc. So I wanted to stop there and kind of just open this up for dialogue and questions.
thank you so much for all of that great presentation in the cases. So for you guys, if you have any questions, feel free to type it in the chat, or you can feel free as well to unmute yourself and ask the questions that you have.
Yeah, I need to maybe I need to turn off my presentation, stop sharing.
Yeah,
Is
you
that
can go ahead.
so that I can see the chat, because I'm not seeing the chat right now.
For sure, you can go ahead and stop sharing.
Okay. Okay, there we go. And then let me see if I can see the chat here. Okay. Any questions at all?
Someone
Okay.
in the oh,
So so the question is, can I tell you more about extracurriculars that got me into a combined undergrad med school program? So I did not go into a combined med school undergrad program. In fact, I applied to one. I applied to Brown University, but I was not accepted there. So I went to a 4-year undergraduate program. And the things that I did in high school were really around, I think I tried to do a lot of different things. I tutored, I worked as a candy striper. I had an opportunity to be on the newspaper. And so I had a lot of different things that I did. I was also a foreign exchange student and stayed with a host family in Geneva. And I learned French, and I had won some awards around that. And so I think as I put together my life story, and that's really what you're doing, like what if experiences have you had throughout your life? I tried to distill them down into that one adjective that I mentioned at the beginning. That is how I was able to go to, the 4-year university that I did. So what made me choose my specific field? It's a really great question. I like to do things with my hands. I tend to be more procedurally inclined, and I liked the breadth of the disease processes that I saw in GI. When you're in medical school, you have exposure to a lot of different specialties, but you basically, as you're applying for residency, have to make a decision around, are you going into a surgical field? Are you going to do an internal medicine-based program, and then you go into fellowships like cardiology, GI, endocrinology, nephrology, etc.? Or are you going to do pediatrics and a pediatric-based specialty? those are the main decision points that you have. And I knew that I loved internal medicine. And as I mentioned, Dr. Melman, Ken Melman, who's now passed, but he was such a terrific mentor. He's termed like the giant of all giant mentors. He was just such a wonderful person. And he helped me to think through what really inspired and excited me, because you want to be excited about your work as you go through your career. So that's how I chose that specific specialty. I'm sorry, I'm just trying to make sure I'm getting the questions. I think I answered the one about how I decided what I wanted to pursue in medicine. And again, I would have been happy in any of the internal medicine-based specialties. So I think just being able to think and put together puzzles is something that really intrigues me. So the next question is about being from another country and advice about how to adapt in medicine. And I think, healthcare delivery is needed throughout the world. And so I think it's really gaining as much exposure as you can and finding mentors along the way that will take you under their wing and show you what's possible. And then, and then you will grow and adapt over time. Let's see. I see. Well, I think having research opportunities is a great way to be able to study abroad and specialize in whatever field you're interested in. I agree that, it is hard when you're coming from a different country and you want to come to the United States. It is hard to find those opportunities, but not impossible. Not impossible. So a general question, a topic which I touched on. I have met many patients who are distrustful of healthcare and unwilling or unable to get the proper care that they need. How do you think that we can get patients to trust the healthcare system again? Wow, this is a fantastic question. I think one that we grapple with all the time. So, there are different thoughts about the role of the healthcare team, the role of the physician in taking care of individuals. And years back, you probably all, well, maybe you remember like the, TV figure Marcus Welby. It was very paternalistic type healthcare delivery, meaning the person was taking care of, the physician was taking care of the individual patient as though that was their family member, and they really were telling them what to do. And as we've had more and more access to information and we've sort of been thinking differently and more autonomously, people really want to be able to think for themselves. And you can find a lot of information on the World Wide Web. And so there's been a change in the relationship between the patient and the provider, whether it's a physician, a nurse practitioner, a physical therapist, and so on and so forth. There's been a change, and it's been a little bit more of an equalization of the roles and the ability to find information. I think the way that we regain trust is, number one, to treat people as though they are your family member, to care about what you do, and to not think of this as a job and getting in and out as quickly as you can, but to think about it as you're really making an impact in the lives of others. I also think communication is absolutely critical. And one of the things that I learned from the pandemic was that we had a drop off, a voltage drop in what was being communicated and what was being heard or understood. And it's very important as you go through the medical field. It's very easy in your training to speak in medical jargon because there are the words that we use, the acronyms, the this, the that. But think about the person sitting across from you who's having, number one, a life-changing event, is scared, is anxious, And it's probably hearing 1 out of every 5 words that you're saying. It's really important that you practice simplifying concepts, thinking about how you communicate in a way that anyone can understand. Someone who has a 2nd grade language ability, all the way to a professor or a PhD. You have to be able to speak and distill very complex ideas and thoughts into more simple terms. And actually, it's a great way for you to learn as you go through medicine, is really simplifying and thinking through and making sense of things. And when you're able to communicate that way to the public, that's where the trust comes. When they feel that you care and they know that you're listening and they understand that you're communicating in a way that meets them where they are. So what do I think young people looking to go into healthcare can do? I think you get as much exposure as you can. I think this forum is fantastic. I think trying to get into situations where you can actually shadow and observe, talking to people, working in ancillary fields, the food bank, for instance, or other areas where you're taking care of people right now. Social determinants of health are now known to be a very big factor in healthcare outcomes. So the ability to get transportation, the ability to have housing, the ability to have food, all the things that I had the privilege of getting involved in during my career, those are now coming out as important to how people do in terms of their overall health. So I think getting involved is what medical schools are looking for. They want to see leadership. They want to see commitment, work ethic, of course, intellect, and the ability to communicate with people. I did not take a gap year between undergraduate and medical school. It was a very, very different time. Gap years did not typically happen back then. I took my MCAT during my junior year and then went forward with the application process. It's very different of a process now. I know this firsthand because I have 2 sons that are in medical school, one that's graduating in May and one that has just started. And so I've seen the process firsthand, and I know it's very challenging. And I understand why people take gap years now to do what they need to do to get the experience in research or teaching or to get another degree, along with taking the MCAT, et cetera. So it is a very different process now than it was 30 or 40 years ago when I went through it. So I want to clarify, I'm not an academic physician, but I work in an environment that I feel is as close to academics as possible because we teach one another. We teach our patients, we teach each other, have an opportunity to really learn the evidence and use evidence-based guidelines to direct my thinking and my decision-making. How did I decide the type of research that I wanted to do? It really was about the mentorship. It's not about the project. It's about the accessibility that you'll have to people, whether it's in a lab or in a clinical training environment. That's what's most important. What's their track record? What do people that have worked with them say about them and their availability? And that's what helped me to decide. I did some research in endocrinology and immunology. And then as I went into my fellowship, I did research in liver disease and gastroenterology. I think I shared one of the biggest obstacles. It was this time in my life when I had a newborn and I found myself alone 3 days after my delivery because the other partner had left, and this constant tension between being giving my patients what they deserve and also providing for my family the way that I want to, and realizing that everything's just going to have to be good enough, especially at home, that I couldn't be the perfect anything for, especially with my family, because you have to, when you go into a service, such as being a physician, you do have to prioritize your patients. And I do feel though, now that I've come out on the other end and both my kids are grown and off onto their own training and development, I think I did just fine because, they feel that they learned a tremendous amount over time, and the way that everything happened was the way that it was meant to be. So I think though that that's a tension that you'll feel throughout your life is, can you find that balance, especially when you're in medicine? And again, figure out what your purpose and your mission and your North Star is and hold tight to that. And then everything sort of falls in place around that. So I decided to do internal medicine. Let's see, I finished, I'm sorry, now you're dating me because I finished undergraduate in 1988 and then medical school in 1992. So I had to decide in 1991. So I was in my 20s, probably around 24, 25 when I made that decision. Let's see. What should all pre-med students think about when they progress through undergrad and apply to medical school? So you're building your life experiences. And what's most important is that you think about what you're going to get involved in, your commitment to that, your commitment to your studies, but also having friends. Because you have to have that balance as you go through this. It's a tremendous amount of work. And learning how to keep that balance is incredibly, incredibly important. And it's not so much the activity itself, it's the ability to commit, it's the ability to lead, it's the ability to mentor others that matters. And those are the things that you're going to write about and convey when you're applying for medical school or undergraduate, etc. Would I change anything in my work-life balance? I mean, always you look back and you think, I wish I could have gone to that soccer game or that tennis match, or I wish I could have, but I think I did as the best I could faced with the circumstances that I had. And there were a lot of things that I said no to. When my kids were young, I did not want to travel. Fresno is one of the southernmost areas of our Northern California geography. And I really did not want to commit to things that would make me travel a lot because I knew I could work after they go to sleep. I could do things and extend my day in a way that wouldn't impact them. But if I were absent all the time, because, I was on call also, so you have to factor all these things in. I just wanted to prioritize them. And I did that until our youngest son was finishing high school. Then we moved up to this area. So I think you just kind of have to figure out what's really important to you, prioritize it, and then say yes. You want to say yes. You want to prioritize saying yes, but you have to know your boundaries and your limits. And that's where having that North Star, that purpose, is absolutely important. So how does a day in my job currently look like? My days are pretty busy. As I mentioned, I have a number of leaders that I oversee, so I meet with them. I attend a lot of their meetings where they're leading things. I interface with our health insurance individuals on sort of bigger projects and goals. And, there's a lot of problem solving, and that's what I do in my current role. My days start very, very early. I don't recommend this, but my days start before 5 a.m. and I work into the evenings quite typically. I see patients a few times a month, not like I used to. I used to be 100% plus doing patient care. And now I do less of that. And I always try to give my patients my full attention when I'm with them, even when there's a lot of different draws. So I think finding research opportunities, some ways to do that is to actually look at a local university and find out the names of professors that are there. And then you can go into PubMed and you can see what's been published and you can get an idea about their areas of interest. And then you have to kind of do that legwork of contacting them to see if they're open to your working with them. And it's all about teaching. Medicine and our profession is all about people paying it forward and you're paying it back. And I would say most are very, very receptive to being in that role. At least that's what I've always experienced and I've tried to live by. Yeah, I think I answered the question about someone who's in high school and trying to get into a good college. Of course, it's grades. Of course, it's standardized testing, but it's also about commitment, leadership, breadth of activities, interests, and mentorship, teaching, things like that are very important for medicine. Yeah, so with respect to social determinants of health, as I mentioned, it's a very, very big area of focus right now because the impact on health outcomes has become very, very pronounced. And so I think this is where volunteering at your food bank and becoming a leader, my younger son did this, was a leader at one of the food banks and worked there for 4 years and showed that commitment and was given leadership opportunities. It's not always about finding medical experiences. It's about finding experiences where you can make a difference and then being able to keep a journal of things that have happened, people that you've encountered that have impressed something upon you that you've learned, and then being able to write about that when you're applying for schools. Okay, I think we're at the end of the questions, Hiba.
Perfect. I do have a question. As you have mentioned, of course, as like when you started medicine until now, there are a lot of differentiations that have happened and the entire field have changed. Where do you see the health system going, or like what new things that can come up that can enhance the medical field as it come? Where do you see it going for the future, especially with the AI being involved and all of that?
Yeah, it's a great question. And exactly what you said, augmented clinical intelligence is the future. And the question is going to be, how do you take that and harness the technology and still have the human connection with that technology? And right now, with all of everything that AI offers and everything that can be harvested from the internet, it's amazing what you can learn. And before, we used to have to carry, our jackets would be so heavy because we'd have all these little pocket guides of this, and you'd be carrying everything in your lab coat. And now really all you need is a little iPad or a phone to be able to look things up. That's one thing, is that learning is very different now. The other is, as you mentioned, AI, or I'd like to call it, augmented clinical intelligence. That's a game changer. So it's the large language models that are coming in, the ability for patient conversation and physician interactions to be recorded for you. So you don't have to document your note. You just have to edit it. And while you're sitting, and it can actually be done in a way that's medically translated. And the impact that augmented clinical intelligence is having in the field of radiology, in the field of ophthalmology. There's just so much. And then you think about what's happening with, quantum computers and what the impact that will have on pharmaceutical production. There is just so much that, again, just getting involved is what matters. And then your experiences will take you to where you should go.
Thank you. And other questions, we'll usually get a lot through our sessions, and so something to touch up on. If a student has like multiple specialties that they have in mind, or they do share like a very similar kind of a work style or missions and all of that, what do you can give them as an advice or like a breakup point that they can consider for them to like consider that just that one specialty they can go into?
Yeah, so I think what's important when you're choosing what field you want to practice in is that you're going to be practicing in that field for a very long time. And you want to make sure that you have diversity in your day so that you don't get bored. And you want to be sure that you have an opportunity to be able to practice in any different setting that you might find appealing. So whether it's in a community-based practice or a solo practice or with a larger medical group or an academic institution. So you want to be thinking about what really draws you. And then you want to talk to people because, again, learning from others and their experiences is absolutely critical in shaping where you're heading and what you're interested in. And you kind of know, am I someone who's likes to work with my hands, or am I someone who likes to just really think about things? Am I someone who likes to work in a team? Now, I will say that most of medicine now is very much a team-based practice or sport. But you kind of get a sense of what you want to do. Do you want to be someone who has to think fast on their feet because you're in an emergency room type situation and you have this ability to assess people rapidly? Are they sick? Are they not sick? What do they need? Come up with a good, differential diagnosis and then get them to the place that they need to go, whether that's home or to the hospital or the operating room. So those are the types of things that you need to be thinking about. So read about what the different fields are all about and then talk to people.
For sure. Another question I might have, I don't know if it was the same thing on your timing of medical school, but as we know that like the first 2 years it'll be like you're in classroom learning everything, and then your last second years will be like you're in clinics or in hospitals doing hands-on. If have you ever had any obstacles moving from that transaction to the other, and what made you like overcome it, and what advices would you give to current medical students that have to go through that?
Yeah, thank you. So medical school has changed, and the clinical practice is now integrated into, at least what I've seen with my two boys, it's integrated in the first couple weeks of school. So it's no longer 2 weeks of college, really fast college, and then you go into the clinical training. It's actually now, at least in the US, most of the programs have you start your continuity clinic the second week of medical school, and then you have a shortened amount of time that you're doing more of the book learning, and it's about organ systems, less so like biochemistry or immunology, et cetera. So it's very different now. So you are integrated in. I'd say the one thing that was challenging was this idea that you go from your second, this was back in the day when I was training, you go from your second year where you're almost like a college student. You have your weekends off, you have your studying, but you have your evenings off. And then all of a sudden you're on call and you're rotating and you're doing overnights and you work on the weekends and everything changes and it's night and day and it all happens over one summer. That's how it was before, but now it's changed. So I think the way actually what I see right now is better than what we had before. I think medicine, and the practice and the training is always evolving. And I like what I see right now.
Perfect. Thank you so much for answering my questions. It's very insightful from you. Does anybody have any other questions that you want to ask before we wrap up?
My name's Victoria, and I'm actually in the middle of moving, so I'm a little bit distracting right now, so I apologize for that. But my question to you, you had mentioned that you had gone to residency at UT Southwestern, and
Yes.
I'm actually a Texas native, so I always kind of look towards and gravitate towards medical
Uh,
practices in Texas, of course. And obviously, with the prestige of UT Southwestern, I know that's not exactly just a straight up an option. There's still obviously an application process.
yeah.
So how would you kind of describe the environment that UT Southwestern provides and
Yeah.
in a couple words that describe,
Yeah.
who would out ultimately fit in that environment?
So, UT Southwestern was the highlight of my training. Um, it was very formal. And I still remember the physicians that I learned from, our chair of medicine, and again, my first attending, and very, very fond memories. It was a very hard program because it's a level one trauma center, as you know, and the patients were so sick, and it's a county experience for the most part outside of Zale Lipsey. Um, it was the best time of my life. And in terms of my training, I I just can't speak more highly about it. And if you have a chance to train there, I would highly, highly recommend it.
Perfect. Yeah, that's all I kind of really wanted to know, just kind of what it took to be a part of such a program.
Yeah, I
Um,
mean, you have to be willing to work hard. I don't know what their rules are now. That at the time that I trained there, we didn't have attendings in the emergency room at night. And I know
mhm.
that changed because by my third year there were, but my second year there were not. And so it was a very hardworking, very intense program. But I just learned so much medicine. And I'm really grateful for my experience there.
Awesome. Thank you. Perfect. Thank you for your insight.
Sure. Good luck moving.
Thank you.
Thank you for your questions. Anybody else? Okay, let me share my screen. Okay. It was such a great session. Thank you so much for all of the questions, you guys, and thank you so much, Doctor, for responding to each one of us. It's very great information that I think I personally also gained today. So please go ahead in the chat. Let's at least reflect on one thing or multiple things that you have found very interesting today. Like any major takeaways about her journey or just anything about the medicine or the journey to get there. You can go ahead and type it in the chat, or if you want to unmute yourself, you can also do that. We do always look up to enhance our live sessions and make it better and more moving on forward with every live sessions that we have. So we do have a articles that we have on the website. They can always go on the blog and submit your ideas, your feedback on how we go, how we did, what things that we can add, what thing we could remove to make it better. It's a very easy. We'll put it in the chat. If you would like to give us feedback, you can just write anything on your mind that you wanted to tell us about the live sessions in general, and we will always take it into consideration. Again, if you would like to stay more into the loop with PHS other than just joining us here as an amazing student, you can also join as a volunteer, which doesn't take as much responsibilities as if a team member. They do have different requirements. You can always look them up on the website. We do have the links attached in the chat, and we can put them again for you. So if you want to go ahead and take up on it, we do we don't really take much usually to look at the applications we get or the forms. If you have any questions, you can always email us at info@freehealthshadowing.com with anything. If you want to just double check if a role is for you or not, what if it's you or not, we're very open to answer any questions that you may have. Again, we are a free program nonprofit, so we do run on donations. So if you can go ahead and scan the QR code, donate as anything you can, or if you can share it with your family members, friends, or other students, it will be great. So we can get us whatever donations we can get to keep that accessible and free for you guys. For this live session, you will be able to gain a digital certificate for your shadowing hours for today, which will be for 2 hours. The quiz is already up on the website. You can take it. It's a very easy 10-question quiz. You can take it multiple times just in case you didn't get it the first time. You did at least 70 or 80% to pass to get the certificate, and you'll be able to download it right after. Also on the website, you will have the recording posted. It takes up to 24 hours for that to be there in case if you want to refresh on anything, if you missed anything. You can also gain shadowing hours from previous sessions that we had. We do have our live sessions posted on our website and our YouTube channel, so you can feel free to go down, watch any video you want, take all the quizzes, down all of the certificates, and that's how you can gain more shadowing hours. And for sure, keep the certificates for record, just in case if you need it for later, applying for anything, and you need a backup proof of it, you can always submit those as well. Again, we have a YouTube channel where we post everything on there, like the lesson, the live sessions with every professional we have had before, so you can always go ahead and check these out. Make sure you're always on our mailing list to get our weekly emails where we have all the updates within the organizations, with their live sessions or other stuff that we do. And yeah, we do have a lot of multiple live sessions coming up. We have one this Thursday, and we have more next week as well, and moving on to the year. So just stay within the loop to join and enjoy other sessions that we have. That's all for today. So if you have any questions, you can feel free to stick around or unmute yourself, type them in the chat, or just anything in general. Feel free to go ahead and speak it out.
Thank you.
Of course, thank you for joining us.
Thank you so much. Have a great day, everybody.
For sure. Thank you for joining.
Thank you for everything. Thank you.
Thank you.
Thank you so much for doing this for students. This is amazing.
For sure. I'm happy to have you here. You can always join at any time.
Thank you.
Mm-hmm.
Thank you very much.
Of course, you're welcome. Thank you for being here, guys.
Thank you.